Hi, I'm Dr. Susan Benedict. We are going to adjust my friend Reba. She's had shoulder difficulties for how long?
I would say off and on, just all of a sudden it kind of grabbed me.
Okay, all right. We're doing camp medicine today. This is copper pennies. Usually give patients a big wad of copper for electrical ground, but we're doing camp style today.
Okay.
So I'm going to have you go face down. All right. Okay, I always check this. This is your right shoulder, and this is your left shoulder. This is the one that hurts, right?
Yeah.
Okay. What I use as an indicator is a short leg, long leg. All chiropractors have indicators. That's how they communicate with the body. That's how they're figuring out what went where. So I'm going to give Reba's neurologic system impulses. I'm going to basically ask questions by putting in the impulse. I'm going to start right here. This is called occiput, this bone. So I'm going to give a shove on occiput. I'm asking if occiput is out of alignment. And I've got 3 seconds to come down to her feet. And yes, I got to pull up, so that means yes. I'm on the dusty trail here. I'm going to find out more things. So I'll just keep doing that. I'll keep asking questions and getting answers. Her whole occiput is off, I can tell you that.
What's an octopus?
Occiput is this bone right here. It's the very, like where my hand is, it's the very bottom of this. This is the parietal bone. That's like the biggest bone in your head. You got 28 bones in your head. Parietal is like 1, 2. You got 2 of them, kind of on the top of your head. This one's on this side. Your left side is Willy Wonka. Very strange. Do very weird things. Okay, here we go. Let's just see if these bones have, your cranial bones have sutures that are just like the teeth in a bridge, and they're supposed to breathe. That's how they're designed. And what happens, at least what I notice, in America, we think too much, and our cranial bones tend to jam together, and then they can't move. So what I do is just gently get them so that they have that space where they're breathing again, and they can do that little oscillation that they do. I think you've been thinking too much.
Oh, I had a roommate in college tell me she could feel me thinking through the wall.
Darling girl, I'm so glad we're together today. You are a mess. Oh my gosh. You're going to feel so much better.
Yay.
Alright. Okay. This is the classic inferior posterior. That's the bad one because a lot of people, they have both of these sides down. They're kind of tucked like this. They can't really walk. They can't breathe. They're stuck like this. This is the miracle one where a person comes in with a cane and he goes off your table and he walks. It's a miracle. That's a double posterior. Get ready, Reba. Sometimes these sting a little. You okay? I'm going in between the ribs. Woo! Okay, they're going forward. I thought there'd be some. Wow, you're going to feel like $1,000,000.
Yay.
Arise, Lazarus.
No, that's better.
Yeah.
Definitely.
So Reba had left shoulder pain for some months. Yeah, and it was getting to the point where she couldn't turn her head and she was in pain all the time. So we've adjusted her spine, her cranials in her head, and her hall of vertebra. She's not in pain anymore. Her instructions for tonight are take a saltwater bath, or she has some other herbs, mustard, that's just great. And she's gonna heat that neck twice a day for 15 minutes. And that's your homework. So, and then call me and let me know how you're doing.
Perfect.
Okay?
Thank you.